Some companies try to lower healthcare costs by rewarding employees who make healthier choices. But pharmacy giant CBS Caremark now says its workers could be fined $600 a year. Employees have to report their weight, blood sugar, and cholesterol levels to avoid the penalty. Julio Portalatin is president and CEO of Mercer, a human resource consulting firm. Welcome.
Thank you, Charlie. Thank you, Gail. How you doing?
So tell us, what do you think of this policy by CBS?
You know, there is a way to be going about these things that we think is much more positive, quite frankly, in rewarding good behavior. We think that different cultures respond to different ways of being able to move behavior from one side of the equation to the other. But what we have found in our consultancy services, that we tend to be able to partner with employees more readily for sustainable health advantage and health improvement in their behavior if you do it in a very positive and rewarding way.
Like what? What do you mean? Because I don't want to tell my company how much I weigh, ever.
Yeah. So certainly I could appreciate that. That's why we encourage voluntary programs to actually have employees look at the way they, for example, offering assessments of the way health patterns and how the way individuals carry on their healthy living choices. And with those assessments, there would be a result of that assessment and then a dialogue between the employee and the employer as to what they might be willing to actually invest in to ultimately be able to change their health patterns, thus helping with overall health costs, because this is what this is all about, right? At the end of the day, it's about lowering health care costs, and it's also about hopefully being able to influence positively lifestyle.
So what kind of incentives work best?
Well, we think that, for example, if you take a company like Colgate, a global company in over 100 countries that we consult with, and they have put in a Live Better program, which in essence is endorsed from the CEO and senior managers down. They actually model behavior of life health improvement themselves, which then encourages employees to do the same thing. They run contests to be able to actually pit improvement of one group versus another group, and it kind of engages the employee as part of a process.
Does it lead to lower cost?
You know,
are you finding that?
You know, in 2012, we had the lowest increase in health costs that there's been in the last 15 years. Now, I'm not going to suggest that the only reason for that is because of wellness programs, but certainly more companies that have, let's say, 500 or more employees are using wellness programs today than ever before. In fact, it's doubled in its usage in the last year or two than it was prior to. And that's really a major shift that's happening that we think has something to do with the slowing down of the rate of growth of health costs.
Before we go, we should mention that among the people you advise other broadcasting companies, including CBS.
That's correct.
All right.
That's correct. And we love our clients.
That's a good way to end that segment. Thank you, Julio Portalatin.